Hi, I'm David Ward. If you've been diagnosed with an autoimmune disease or are experiencing symptoms such as chronic pain, fatigue, brain fog, or cognitive decline related to some other chronic inflammatory condition, and you're struggling to achieve sustained remission or relief from your symptoms, I want to talk to you about why your immune system is creating chronic inflammation. Every day, we're exposed to an infinite number of threats to our health in the form of toxins, pathogens such as viruses and bacteria, and other lifestyle and environmental stresses. Your immune system has a process called the healing cycle that it moves through in response to these threats. Inflammation is a natural part of the healing cycle that's used as a method of protection. We want inflammation to be purposeful and not sustained, activated when needed and resolved after the initiating threat is neutralized. The ability of your immune system to activate and complete the healing cycle after encountering a stressor, ready to tackle the next threat to your health that comes your way without creating ongoing inflammation or a flare-up of symptoms, is your immune resilience. Now, when you look at the immune inflammatory response, it breaks down into four main steps. First, there's activation of the inflammatory response, which happens when immune cells in body tissues identify a threat, like bacteria or viruses, toxins, or tissue damage. The resident immune cells in the area of the threat then send out signals that trigger an influx of additional immune cells to fight the invader or clean up the tissue damage. That's the recruitment stage. Next, there's amplification, where signals related to the neutralizing of the invader activate a secondary inflammatory pathway, resulting in escalating inflammation. Lastly, there's resolution, where the inflammatory process is turned off. Resolution of inflammation is an active process that's largely dependent on an adequate supply of chemical compounds called pro-resolving mediators. Now, when inflammation becomes chronic, it's because you've lost your immune resilience and you're stuck in an incomplete cycle of healing with sustained inflammation. And when inflammation becomes chronic, there are generally four main reasons. There may be recurring activation, ongoing amplification, impaired resolution, or a weakened immune system with an inability to fully eradicate the threat. In order to normalize the inflammatory response, it's necessary to identify which of these four are driving sustained inflammation. In many cases, it's a combination of factors. And a key aspect of identifying the drivers of chronic inflammation is to understand their sources for a given individual. These include chronic infections, imbalances in the bacteria in your gut and mouth, increased intestinal permeability, referred to as leaky gut, environmental toxins, sleep disorders, and nutritional deficiencies. Each individual has a unique combination of these factors that can result in chronic inflammation, so we use a personalized precision approach that identifies the root causes of the loss of immune resilience specific to you as an individual. We then use lifestyle-based strategies to support restoration of immune health. This is a functional healthcare approach that includes recommendations for diet and nutrition, movement and exercise, optimizing sleep, supporting healthy stress response, avoiding toxins, and supporting the body's detoxification processes. For more information or to explore whether this approach is right for you, visit the link or scan the QR code to schedule a free discovery consultation.